Preventive orthodontics. The preventive orthodontics represent all the procedures undertaken to preserve the integrity of normally developing occlusion by protecting the current conditions or preventing situations that would interfere with the growth. In the preventive orthodontics, we make all the procedures that preserve the normally occlusion. That means the case is diagnosed as normal occlusion and normal path of growth, and we have to undertaking or working in all procedure to preserve the normal occlusion. The rationale or the reason for the preventive orthodontics is for timely detection of future problem, to save the time and money for the patient, and to improve the patient and dentist relationship. For making the prevention or the preventive orthodontics, we have many requirements. The first requirement is the clinical uh, diagnosis and the clinical procedure that taking for the success of the preventive orthodontics. The clinical procedures need a cooperation from the patient by making a periodical checkup and visual examination at least every 6 months, and in this case the dentist should be able to differentiate between the potential problem and the self-correction condition for the development of the occlusion. In addition, the dentist have to identify any proximal caries that may affect on the space creation or space loss during the eruption of the permanent teeth. The preventive orthodontic give a psychological advantage for the patient to improve his appearance or appearance of his teeth, to improve his psychological take. Prevention also remove any etiological factors that restore or affect on the normal growth, in addition to the possibility to achieving better result in the future orthodontic treatment. The preventive orthodontic have indication for the correction any bad habit in the early stages. For making the preventive orthodontics treatment, we make a periodical intraoral radiographs and panoramic radiographs, and this panoramic radiographs should be taken at least once a year to detect any eruption problem or any problem in the sequence of the eruption of the permanent and the primary teeth. The preventive orthodontic procedure include a non-appliance preventive orthodontic procedure and appliance preventive orthodontic procedure. For the non-appliance preventive orthodontic procedure include the first with the parent education. The parent education include the education or motivation the parent about the importance of the nutrition for the child before the eruption of the primary teeth until to the completion of the permanent teeth and the adolescent growth spurt. And in addition to the mode of the feeding of the child and the type of nipples used in the case of bottle feeding and the use of physiological nipples for the bottles for the child. In addition to the maintenance of the oral hygiene, the maintenance of oral hygiene of the child begin with the infant from birth to the 1 years, and in this case the parent have to wash the mouth of the child by moistured gauze or wash cloth, and can be used gently to massage for the gums and cleaning of the newly erupting primary teeth. For the toddlers, who is the children from 1 to 3 years old, we can introduce the toothbrush, and the type of the paste is non-fluoridated toothpaste, and the parent should brushing the teeth of their children began to introduce the toothbrushing to their children. The preschool children from 3 to 6 years old, the children begin to brush their teeth under the supervision of the parent. In addition to, they use the fluoridated toothpaste. The other procedure of preventive orthodontic treatment is the caries prevention, because when there is a pulpal involvement of the primary teeth may cause extraction, and the early extraction of the primary teeth affect on the arch length and cause of loss of the space for the succedaneous permanent teeth. In addition, the proximal caries, as in this picture, when they can cause reduction in arch length, and when the restoration of the proximal restoration or amalgam restoration, when it is under contoured, can result in loss of contact with reduction of arch length. Another parameter or procedures that undertaken by the dentist as an non-appliance preventive orthodontic procedure is the maintenance of the shedding and eruption timetable. As a general, the deciduous teeth should exfoliate in about 3 months of the exfoliation of their counterpart in the contralateral arch. In addition, the permanent succedaneous teeth should be erupted within 3 months of exfoliation of their procedures. And in this case, the dentist need for the panoramic X-ray as a preventive indicator or a radiographic indicator for the monitoring the shedding and eruption time within the normal limit. The removal of supernumerary teeth is regarded as a preventive measurement or preventive orthodontic procedure in case of the presence of the supernumerary teeth that may cause diastema between the anterior teeth when it is at the midline, or crowding, local crowding, when it is present between the posterior or anterior teeth in other position of the arch. The prolonged retention of deciduous teeth can be prevented by extraction the retentive or deciduous teeth, because the prolonged retention of deciduous teeth may lead to abnormal eruption pathway of the succedaneous permanent teeth. In addition, the ankylosed deciduous teeth regard as another type of the prolonged retention of the deciduous teeth. So in this case, you may need for a surgical extraction for the ankylosed teeth when there is a succedaneous permanent teeth, while when there is no succedaneous or congenital missing of the succedaneous permanent teeth, in this case we have to preserve the primary tooth by restoration that can withstand with the presence of the permanent teeth. The management of the mucosal barrier is another non-appliance preventive orthodontic procedure, such as the high frenal attachment and that cause the diastema between the teeth, in addition to the mucosal impingement that affect on the eruption of the permanent teeth. And another non-appliance preventive orthodontic treatment include the occlusal equilibrium. That means occlusal equilibrium elimination any premature contact between the teeth that may cause functional shift of the mandible when the functional shift is anteriorly of the mandible, cause a pseudo class 3, and when the functional shift of the mandible due to the premature contact between the teeth is laterally, cause the cross bite. In addition to the overextended restoration may cause occlusal prematurities. The delay locked first permanent molar, as in this case, it's affected by the presence of the primary second molar, can cause deeply locked or partially uninterrupted first permanent molar, and in this case, the reapproximation or proximal stripping of the distal surface of the primary second molar regard a preventive orthodontic procedure to correct the deeply locked first permanent molar. Another type of preventive orthodontic procedure is the using of appliance, or called the appliance preventive orthodontic procedure, and it's include the habit breakers and space maintainers. The habit breakers used for management of oral habit. The management of oral habit begin with the education of the parent about the sequence of abnormal oral habit, in addition to the education and motivation of the child to stop the habit, and using of removable or fixed habit breakers that eliminate the oral habit, and the using of habit breaker should be undertaken after the 6 years old or before the eruption of the anterior permanent teeth should be undertaken, and the education of the parent and motivation of the child before the 6 years old and after the using of the habit breakers. For the maintaining the space after the premature loss of the deciduous teeth, we have to use space maintainers, because the premature loss of the deciduous teeth may cause migration of adjacent teeth into the space, and non-eruption or altered path of eruption of subcutaneous teeth. In addition, when the missing teeth or premature loss of anterior deciduous teeth causing a tongue thrusting with effect on the phonetic of the child, in addition to the unaesthetic appearance of the face when there is a missing of the anterior teeth, and in this case, as in this picture, we using a removable space maintainer to restore the anterior teeth for give an aesthetic appearance of the child, to affect the psychology of the child, in addition to they maintain the space anteriorly before the eruption of the permanent teeth. The space maintainers are indicated mostly when the losing of the deciduous teeth is prematurely, and when the permanent teeth is will erupted as soon as possible. We not indicated the space maintainers. In addition to the space maintainer, whether it's fixed in a case or uncooperative patient, or removable space maintainer used for the cooperative patient, and to prevent any space maintainer, especially in the posterior teeth, used to preserve the integrity of the arch length and to prevent any mesial migration of the deciduous teeth. Thank you.